Hello, I'm Brooklyn Borough President Antonio Reynoso. I want to thank Coney Island Hospital for inviting me in honor of Black History Month in 2022. The theme of Black History Month this year is health and wellness, which is extremely appropriate after what we've all been through over the last 2 years of this pandemic. I want to start off by saying thank you to all the essential workers who have gone above and beyond to keep folks safe and healthy during the pandemic. I want you to know that I see you and I appreciate every one of you. As we hopefully begin to emerge from these difficult pandemic times, I want to address another issue related to Black health and wellness that is extremely important to me personally. As you may know, I have 2 children, my son Alejandro, who is 4 years old, and Andres, who is 15 months old. My wife Eliana delivered both of them at another health and hospitals facility, Woodhull. I believe that because we were very lucky to have excellent midwifery care, that my wife and both my children were healthy throughout and after the birth. However, many Black people who give birth are not so lucky. In fact, Black mothers in New York City are on average 9 times more likely to die due to childbirth than white mothers. While studies do show that doctors are less likely to listen to Black mothers, there are also social determinants of health that exacerbate this problem, from lack of access to healthy food and safe and healthy housing, to overexposure to harmful environmental conditions and chronic stress. This isn't just about healthcare, but about addressing systemic racism in all parts of our lives. That said, access to quality healthcare is a major issue for Black, and brown communities, especially much-needed mental health care. Mental health conditions are at the top cause of pregnancy-associated deaths due to outcomes such as overdose and suicide. These deaths are preventable if we ensure that all birthing people have pre- and postpartum access to mental health care, substance use treatment, and interpersonal violence interruption. We can also make sure that birthing people have access to personalized care through midwives and doulas. Increasing midwifery access decreases unnecessary medical intervention of people in birthing process and decreases maternal mortality and morbidity. It's my goal as your borough president to make Brooklyn the safest place in New York City to give birth in the next 4 years, and the safest place in the country in 8. This will start with an infusion of resources into public hospitals like this one, to create state-of-the-art birthing centers, and creating partnerships with Mayor Adams and local institutions like Brooklyn College to make sure the needed staffing is available. Again, I want to say thank you to all the workers at Coney Island Hospital for everything you do for our community. We are all partners in this effort, and I'm excited to work with you. And to the patients who are watching today, I hope you feel better and stronger every day. Thank you for having me, and remember, spread love. It's the Brooklyn way.